Welcome to my website. I am Dr. GIAN PAOLO TASSI, specialist in neurosurgery, focused the last 12 years on PLDD, percutaneous laser disc decompression. That is a true, minimally invasive interventional disc procedure for disc hernia. I have learned the PLDD at the Laser Pain Center in New York City under the supervision of Professor Daniel Choi, Columbia University, and the inventor of PLDD. Since 2011, when Professor Choi and Professor Johannes Stellinger from Munich, Germany, retired, I have the world's largest experience on PLDD. What is the disc hernia? The spine, from cervical to lumbosacral, is the support of our body, and it is composed by vertebral bodies of bone and discs between the vertebral bodies. Posteriorly to the disc, we have the nerve roots. The disc is of soft tissue, much more in its central portion, that is called nucleus pulposus, which have a rich portion of water content, 75–18% of water content. When the posterior edge of the disc goes toward nerve root, it compresses the nerve, and back pain or leg pain is experienced by the patient. What is the PLDD? The PLDD uses local anesthesia and a tiny needle. The needle, under X-ray fluoroscope, enters from the back into the center of the disc, the nucleus pulposus. After that, the optical fiber is inserted into the needle and it reaches the nucleus pulposus, the center of the disc, always under fluoroscope. After this, the laser energy is delivered to vaporize a very small portion of the nucleus pulposus, and the laser energy has parameters that varies according to each patient. In this way, there will be a breakdown of the intradiscal pressure, at least 15%, and the disc hernia deflates and the nerve is decompressed. The PLDD procedures takes an average 13 minutes for each patient and is performed into the operating room. In my experience of more than 3,500 PLDD procedures, the positive results are 85%, with 4% of recurrences and 1.1% of complication. That is the diabetes or infectious of the disc, even if the antibiotic therapy is done before and after the PLDD. The discitis can be treated with antibiotics at bed rest for 6 weeks or open surgery. This complication occurred also in open surgery for disc hernia, that has other kind of complication, as periradicular scar deformation or spine instability in few cases. A lot of high-impact factor scientific publications have stated that PLDD is a safe and pure, minimally invasive interventional disc procedure. I want to point out that it is not a surgical procedure. The great advantages are local anesthesia, a tiny needle with no cut of the skin and of the muscles, no bone drilling and no ligament removing. To have a good judgment of the result, it's necessary to wait from 1 week to 5–6 weeks, and the normal daily activities need to be very gradual, step by step, day by day. In the following 3 weeks, avoiding forever, if possible, most sports, incorrect body positioning, and heavy load. I have learned the PLDD at New York Laser Pain Center under the supervision of Professor Choi, Columbia University of New York City, the inventor of PLDD. I want to point out also that the patient to be careful when they are searching on the web about PLDD, because there are some doctors speaking about PLDD as a magic wand or producing a regrowth of the disc, and that is a criminal information. It is necessary also to be careful about doctors that will promise a 100% of good results, because no therapy or surgery or minimal invasive therapies for disc hernia has good 100% of good result. The same, it is necessary to be careful when the doctor performs PLDD at a very low price, because PLDD is high technological procedure having high costs.